Good morning. Good morning, everyone, and welcome to this launch of Enlace, PAHO's data portal on non-communicable diseases, mental health, and external causes. I'm Silvana Luciani from the PAHO NCD program, and I'm pleased to be moderating today's session. Before we get started, I'd like to welcome everybody from across the Americas and say that this is going to be a session in English and in Spanish. And we have simultaneous translation. To select your language, please use the icon at the bottom of the Zoom screen with the world globe that says interpreters and select your language. And also the second announcement is that we would like this session to be interactive. So we are going to encourage you to use the Q&A function, which is also located at the bottom of your screen. So please add your questions, comments, and stay connected and interact with us throughout this hour and a half when we talk about Enlace. So many of you know that PAHO has a long-standing tradition as a reliable source of public health, epidemiological, and health system data from countries across the Americas region. Many of you may be familiar with PAHO's seminal health data, publications, and products like Health in the Americas and Core Indicators, and of course, the COVID-19 dashboard. And in this digital age and with all the technological advances supported by PAHO's digital transformation policy, we're constantly adapting the way that we disseminate our health data to make it much more widely available, accessible, and interactive for use by the public health community in the languages of PAHO. So today we're really excited to launch our new data portal, Enlace, which aims to link data to action on NCDs, mental health, and external causes. So to open today's webinar, I'm going to invite Dr. Jarbas Barbosa, the Assistant Director of PAHO, to provide our welcome remarks.
Muy buenos días a todas y todos.
Good morning to all of you for your participation in this event. It is a pleasure to welcome you to the launching of the data portal of the Pan American Health Organization on non-communicable diseases and mental health. It's relevant, and we'll talk about the use and dissemination of data, statistics, and health indicators that are strategic resources to guide health actions for prevention and control of non-communicable diseases and the risk factors: violence, traffic accidents and traumatism, mental disorders, substance abuse, disability, and rehabilitation, which are important public health problems in the region. The data portal is a resource created by the Pan American Health Organization with a view to guide technical cooperation and support all efforts done by member states seeking to improve the health status of the people of the Americas. The portal is distinguished because of its epidemiologic information with all the data the countries have reported and the status of implementation of policies, programs, and health services related to relevant and important public health issues in the region, such as cardiovascular diseases, cancer, diabetes, tobacco, alcohol, obesity, physical activity, violence, road safety, and mental health. To use visualizations, interactive data visualizations, to make the interpretation of the information easier, rapid recognition of the levels, distribution, and trends of the indicators, and encourage our exploring the data to respond to public health questions. Third, offer monitoring instruments of the progress of the plan of action indicators and world commitments, such as the Sustainable Development Goals, to offer summarized information of the main findings of each one of the topics, as well as the definition of indicators and technical notes. And lastly, to allow open access and the download of data through the interactive tools, allowing its use for other purposes. The importance of having and using the data to guide health actions was felt quite strongly with the COVID-19 pandemic, particularly on those topics dealt by the data portal. It is important to act immediately, strengthening information systems, give priority to periodic epidemiologic surveys, strengthening data governance, as well as adopting transparency practices of all data so that they can be broadly used by society, by people who may be interested in public health issues, as well as for decision-making by health authorities in the countries. I want to highlight that this data portal has been possible thanks to the contribution of all member states of PAHO in collecting administrative and health data, as well as with the surveys, epidemiologic studies, populational studies, and the reports of these to the Pan American Health Organization. Thank you very much for supporting us in this event, in the launching of this data portal of PAHO on non-communicable diseases and mental health, with which we want to promote the use of this and the data and interactive tools of the platform to measure progress, identify gaps, and strengthen priority topic programs that are available on the portal. Thank you very much.
Well, thank you to you, Dr. Barbosa, for these kind welcome words for the launch of Enlace, PAHO's data portal on NCDs, mental health, and external causes. Dr. Barbosa is the chair of the PAHO Data Governance Committee and has taken a very active role in ensuring that data standards are applied in Enlace and other of the PAHO data portals. So we are very grateful for this support from senior management at PAHO. We turn now for a brief overview of the Enlace data portal and talk a little bit about the relevance and importance of this new data for the public health community. And I'd like to invite Dr. Anselm Hennis, the director of the Department on Non-Communicable Diseases and Mental Health, to give us a presentation on the data portal and its importance. Over to you, Dr. Hennis.
Thank you, Dr. Luciani. Good afternoon, good morning, good afternoon, good evening to all. It's indeed a privilege and a pleasure to be here, and I extend a warm personal welcome to each of you. Let's put up my presentation. And right, it should be on one slide. Good. Wonderful. So we're going to share some perspectives on the relevance of the PAHO data portal on non-communicable diseases, mental health, and external causes to achieve the commitments, mandates, and action plans through Enlace. Now, the Enlace data portal was developed by the Department of Non-Communicable Diseases and Mental Health of the Pan American Health Organization. And the question is, why are data important? They allow authorities to make informed decisions regarding health. Data allow monitoring and evaluation of programs, which in turn allows course correction when things aren't going well, or scaling up of programs as necessary, depending on how matters are progressing. And data, of course, allows solutions to problems. Data allows us all to keep track of programs and situations. And as Margaret Chan, who you all would know, as the former Director General of WHO, succinctly summarized a key role of data: what gets measured gets done. As such, data are a strategic resource that play a critical role in supporting evidence-based actions and assessing the progress of the implementation of commitments. It also provides a mechanism by which one can accelerate national efforts. So this here now shows how one can access Enlace, the data portal that not only provides information on the health status of the population, but also presents progress on the implementation of policies and interventions to reduce the impact of non-communicable diseases and their risk factors, mental health conditions, and violence and injuries as they relate to the population of the Americas. As you can see there on the left side of the screen, there it is, the QR code for scanning to gain access to to Enlace. Now, as you can see in this slide, in past decades, countries have made significant efforts to implement evidence-based policies and intervention. And this slide here highlights various mandates and resolutions related to non-communicable diseases, mental health, and injuries. But as we can see, much more is still needed. Although we recognize the challenges that the pandemic imposes on countries, we need to find opportunities and ways to not only protect the gains, but also to accelerate progress. Among these commitments adopted by countries, I want to highlight the Sustainable Development Agenda, which was mentioned by Dr. Barbosa. And this includes many of the relevant indicators related to non-communicable diseases, risk factors, mental health, and external causes. And I want to take this opportunity of using the information from the Enlace data portal to call your attention to the status of a few of the SDG indicators in the region of the Americas. So this slide here speaks to the indicator of premature NCD mortality. You will see that the males in the green, in the purple are the females, and both sexes combined are in the black in the center. And this indicator measures the reduction in premature mortality from the four major non-communicable diseases, namely cardiovascular diseases, cancer, diabetes, or coronary artery diseases for the period 2000 to 2019. If no actions are taken or significant scale-up was already in place, it is unlikely that the region of the Americas will achieve the 1/3 reduction in premature mortality by 2030 relative to 2015. And this is the indicator 3.4.1. Therefore, tremendous efforts will be needed to achieve this commitment by 2030. Now, in terms of suicide, as you can see, over on the right side of your screen, countries in red are those which have quite high standardized suicide mortality, which includes Guyana, Suriname, Uruguay, United States, Haiti, Canada, and Cuba. Whereas at the very bottom, in the dark blue, are countries like Honduras, Jamaica, Venezuela, Bolivia, Republic of Venezuela, St. Vincent and the Grenadines, Grenada, Antigua and Barbuda, and Barbados. So there's a wide disparity in the occurrence of suicide. And regrettably, the overall age standardized suicide mortality is increasing, as you can see from the graphic on the left side of your screen. There's substantial disparities, as I pointed out before, but a collective effort is needed on the part of all countries in the Americas if we're to reverse this trend and actually get on track with reducing suicide mortality. This slide here now shows examples from 2 countries of prevalent tobacco use. On the left side is Canada, on the right side is Chile. You can see quite off the top that, the pattern is a decrease in both, but far more dramatic in Canada. And of course, you can also see that tobacco use is higher among men than it is among women. What we do know is that the region of the Americas is probably the only region in the entire world of the 6 WHO regions that will probably achieve the global target of a 30% reduction in tobacco consumption by 2025. So a lot has been achieved. Roughly 43% of countries are likely to achieve a 30% reduction by 2025. 23% of countries will achieve a decrease, but less than 30%. 3% of countries are likely to experience a significant change in prevalence, and we have insufficient data from 30% of countries. But even though I've shown you the trends in 2 different countries, and we think overall we can achieve it, the bottom line is that we wish to leave no country behind. So still the countries that are not doing as well, we need to spur up efforts to reduce tobacco consumption. Per capita consumption of alcohol is another indicator I'll share very briefly with you. It's been decreasing slightly in the region of the Americas between 2000 and 2019. And of course, with all these risk factors, the consumption is higher in men than it is in women. There's a wide variation in the consumption of alcohol across the region of the Americas. We see increasing trends of consumption in Argentina and Panama and the United States of America, but a decreasing trend in Brazil. So really, we need to come behind and learn from the lessons where things are going well and try to apply these lessons to countries where things aren't going as well. This slide speaks to the death rate due to road traffic injuries. And right off the top, we know that the region of the Americas is not on track to achieve the target of 50% reduction in death rate due to road traffic crashes. Overall, the age-standardized death rates from road traffic injuries has been decreasing since 2007. As you can see again, the rates are higher among women than they are among men. There are tremendous disparities, from a tremendous high in the Dominican Republic at 67 deaths per 100,000 population to a low in Antigua and Barbuda, where there have been effectively no recorded deaths per 100,000, and Canada, where there are 5 recorded deaths per 100,000. So again, much to be done and many lessons to learn. So basically, Enlace. We have designed Enlace to facilitate access and promote the use of data to drive actions aimed at reducing the burden of non-communicable diseases, NCD risk factors, mental health conditions, substance use disorders, as well as violence and injuries. It was created with the following purposes: to serve as a gateway to access the most relevant, updated and comparable set of data, statistics, and indicators relevant to NCDs, risk factors, mental health, and external conditions, to provide epidemiological data, national response capacity, which you can inform by information, and the status of implementation of interventions and policies. Thirdly, to support technical cooperation activities and guide strategic decisions to achieve the commitments, mandates, and action plans, and to serve as a tool for member states to assess progress on interventions and policies. We all envisage that Enlace will become a reference tool for the member states, the public health community, researchers, all involved in the effort to reduce the burden of mortality, morbidity, and risk factors, mental health, violence, and injuries throughout the Americas, as well as people working in civil society, as well as members of the public. We thank you for your attention. I'm going to pass the word to Silvana Luciani to moderate the panel of speakers from the Department of Non-Communicable Diseases and Mental Health, who will present specific topics featured in the Enlace data portal. So again, thanks for joining us, and we look forward to a really stimulating discussion.
Thank you. Thank you very much, Dr. Hennis, for showing us just a little tidbit of Enlace and all of the capabilities that it has to monitor and track some of the key health-related SDG indicators. So I hope that's whetted everybody's appetite, because we've now come to the point where we're going to unveil Enlace, PAHO's new data portal on NCDs, mental health, and external causes. And if I could please have my presentation slides. I'm going to briefly introduce the overall architecture and structure of Enlace, and then we will go into depth into some of the specific topics of the data portal to give you an appreciation and showcase the capabilities and data visualizations that are available through Enlace. And by the end of this session, we hope that you will have gained a greater appreciation for what a valuable resource Enlace truly is. It's much more than a database. It's a tool that can help and assist tracking epidemiological data, health services, and health system data. And I can't emphasize enough what a unique tool this is, because it is PAHO's one-stop shop for having data on NCDs, risk factors, mental health, violence and injuries, all in one place, that provides not only data for the year, but also trends and allows comparison between countries. And in addition to the epidemiological data, so data on mortality, morbidity, we have also gathered here information on the progress of some of the key policies that we have made available through our regional plans of actions and regional strategies that cover the topics of NCDs, tobacco, obesity, salt, trans fat, violence, road safety, as well as some of the results from population-based surveys that are going on in the region on adolescent health and youth tobacco. So again, it's a tremendous amount of information. It's data that is meant meant to be interactive, to allow the user to generate trend data, but also to get a snapshot on where countries are in terms of implementing policies and regional strategies. And really this data portal would not have been made possible, as Dr. Barbosa noted in his welcome remarks, without the cooperation and generation of data from our member states, with whom we work very closely to implement surveys, to collect health service, as well as administrative and epidemiological data through standardized population-based surveys and standardized questionnaires. And of course, this is a product of collective work within the Department of Non-Communicable Diseases and Mental Health, with the numerous subject matter experts that we have available in the department, as well as data analytical specialists, IT support, as well as collaborations across the organization. So we're really, really proud to be able to have this new resource available to all of you in the public health community and to be able to launch it today. And we encourage you to visit the site. We've got through the chats and the QA sessions, the URL to be able to access Enlace. And we invite you to play around with some of the data and data visualizations to become familiar with it. But just to review, next slide, please. Just to review again, the purpose of PAHO creating this data portal is really to provide the reliable and timely data that will help support the public health programs on these important public health matters. And it's meant to enable these interactive data visualizations and country comparisons. So if, for example, you're in Panama and you want to see how your country is progressing on tobacco policies as compared to countries in the region, you can do that through the data portal. Or if you want to see what the trends for diabetes are in your country compared to other neighboring countries, you can do that through this data portal. And lastly, it's to monitor progress on the interventions and track the commitments in some of the global and regional plans. And Dr. Hennis has already showcased how the data portal can be used to track the Sustainable Development Goal targets and indicators related to the topics in Enlace. If you can show the next, thank you. And this, of course, data portal is based on a set of stringent standards and principles for database management and data portals that include being open access, and it's updated data periodically. And of course, it complies with the best practices and standards for database and data portal management. The data portal is meant to stimulate data exploration. So it's meant to have the user look at and inquire and submit requests for more information through the interaction of, as you'll see, some of the screens and some of the interactive operability of it. And to look at some of the patterns and to really think about how some of the data applies in your country and what public health actions can be implemented in order to improve the situation in the country. This Enlace data portal is embedded as part of PAHO's overall data infrastructure and governance, and interoperable with PAHO's health information system. Next slide, please. And so when you visit the data portal, you'll see that there are three main sections in the portal. The first is on the burden of disease, injuries, and risk factors. And the burden data is primarily mortality and morbidity data for the four main NCDs, cardiovascular disease, cancer, diabetes, chronic respiratory diseases, as well as a few other diseases, and as well as the mental health and neurological conditions and substance use disorders, the four main risk factors, and violence and road safety and other unintentional injuries. In the next section, there is the monitoring of the policies and strategies and plans of actions that we have available on NCDs, mental health, and external causes. And the third section is the results from population-based surveys on adolescent health and youth tobacco. Next slide, please. So when you get to the landing page of Enlace, what you'll see is the navigation bars, and then two very important highlighted sections that provide an overview of key data on the leading causes of mortality and in the region of the Americas. And then on the right side is the main NCD indicator that we're tracking, that is premature NCD mortality, the trends over time and projections to 2030. So we've highlighted on the main page two of the key data points. Next slide, please. But if you scroll down the page, what you'll see is the division of those three sections. The first section on burden of disease, injuries, and risk factors, broken down by their subcategories. The first one being on non-communicable diseases. And there we have mortality for all non-communicable diseases, and then highlight on the NCD premature mortality, which is that SDG indicator of importance and relevance. And then we go into the individual diseases: cardiovascular disease, cancer, diabetes, chronic respiratory disease, and kidney disease. And each of the icons will take you to their actual data portal, and that's where you can begin the interaction to look at data by country, by subregion, by region, trends over time, etc. And in the second subcategory on mental neurological conditions and substance use disorder, you have the range of topics. Next slide, please. And continuing in the section of burden of disease, injuries, and risk factors. Next slide, please. It seems to be stuck. The next slide would be on risk factors. Next slide, please. So the next section would be on the risk factors. Again, we have data on the main risk factors for non-communicable diseases. Each icon, once you click it, will take you to the site that enables generation of charts and graphs and data by country and subregion and region. And then the next subcategory on violence and injuries. And there you see we have an offering of various topics. Next slide. Next slide, please. Thank you. And then we move to the policies and strategies. And here we have a number of policies that have been set for the region on NCDs through the NCD progress indicators, as well as country capacity survey. We have policies and plans on obesity, on trans fat, on salt reduction, on tobacco control. And again, once you click on the icons, it'll take you to the site, and that's where you can start interacting and obtain some of the data and information on progress with implementing the strategies and plans of actions. And the third and last section of the data portal is on the population-based surveys, and this is where you can actually get the results of surveys from the Global School-Based Health Survey and the Global Youth Tobacco Survey. Next slide, please. Next slide, please. So just to encourage you all to please check out the Enlace data portal. Once you start playing with the data and the interactions, you'll get to better appreciate what the actual value of this tool is for you in your work and in your country. And now we would like to just go into some of the specific topics to showcase the utility of this data portal. And we would like to begin with mental health, recognizing that at the same time that we have a COVID-19 pandemic, we have a mental health crisis in this region and around the world. So we would like to showcase, and I'd like to invite Dr. Roberta, oh gosh, why am I drawing a blank? Renata Oliveira, sorry. Dr. Renata Oliveira, the chief of the unit on mental health and substance abuse at the Pan American Health Organization, to talk a little bit about how this mental health data portal in Enlace can provide you with data on from the region. Over to you, Dr. Oliveira.
Thank you very much, Silvana. Good morning, good afternoon, colleagues. If I could have the first slide, please. Great. If you could just put in full screen, please. Okay, so let me start while we put it on the screen. So it's a great pleasure to be here with you. And Silvana has already mentioned the different capabilities that Enlace has. In fact, we have data, and we can monitor data and trends in different areas of mental health, but not only mental health, mental disorders, but also neurological conditions, selected alcohol-related diseases, and drug use disorders. But here, for the sake of time, I'm just going to go through how we can use Enlace data on suicide to really go deeper and understand the situation of a country, a sub-region, or a region, and all this in a way that Enlace can help countries to develop and improve strategies for suicide prevention. So we are talking about public health, we are talking about data, but we should never forget how suicide is really a tragedy that affects not only individuals, but it affects also families and entire communities. Nearly 100,000 people die by suicide in our region, in the region of the Americas. This is data per year. And we know we have enough information, and we have the knowledge that there are evidence-based interventions that can prevent suicide. And it's also important to mention how the COVID-19 pandemic is really influencing many risk factors for suicide. So bringing again, as Silvana has mentioned, the importance of mental health, but also the importance on strengthening countries' efforts on suicide prevention. Next one, please. Okay, so being suicide prevention an important public health priority in our region, it has been included, first of all, globally as one of the indicators in the sustainable development goals. So it's a data that we expect that countries monitor and report, and in a way that we can be advancing on reducing the global rate of suicide. Here in the Americas, we have been also monitoring the suicide regional rate, and it has also been incorporated in our plan of action on mental health that in fact has ended in 2020, and we are now working on a new policy and strategy for mental health for the region. But this is just to say and to emphasize the importance of suicide as a public health problem, and the importance of scaling up efforts on suicide prevention. In fact, our regional suicide rate has been increasing over time. In our plan of action is one of the indicators where we in fact did not achieve the expected target. And we also know that when we compare our region with the other WHO regions, we are the only region where the suicide rate has been increasing over the last years. When we analyze the data coming from the countries and now available in the portal, you will be able to see that there are countries, and in fact the majority of the countries, the suicide rate has not changed in the last years. Some of the countries, in fact 9, are going back with suicide rates at the country level increasing. And so it's a problem of concern. And when we look at the data in the last 20 years, we see that our regional rate has increased by 17%. Next one, please. You can go to next one. I have mentioned this already. Great. There are other ways that we have been monitoring data in terms of mental health, and what we do on a regular basis is collecting data that are submitted by countries and put together on an atlas, that is the global atlas, and we also produce a regional atlas that allows us to monitor and support countries by describing different regional indicators on mental health. Next one, please. So with Enlace, countries can assess the progress on global and regional suicide prevention targets to determine if a country is on track or not, Enlace can also help to target health promotion and suicide prevention campaigns, design programs and formulate policies to strengthen suicide prevention. And in fact, it's a source of data that can be downloaded for discussions at the country, sub-regional and regional level in order to better understand what are the best ways to advance with suicide prevention. Next one, please. So we have put here a set of questions to really show you how Enlace can be of help in specifically in the area of suicide and suicide prevention. So what is the current suicide rate in my country, if I want to know, and how can I compare with other countries in the region? Next one, please. We have shown this slide before. You can see the suicide rate per country. You can compare with the median suicide rate. You can compare with the regional suicide rate. But you can also, by clicking on the buttons that you have on the screen, divide by age group, by sex. You can see over the years, and there are different measures that can also be analyzed. Next one, please. If I also, if I am at a specific country and I want to understand what is the burden of suicide by age and age in my country, next one, please. Enlace also allows me to see disability adjusted life years, years lived with disability, and years of life lost, stratifying by country, by subregions, by sex, but also by age group and by year. Next one, please. If I want to see how the suicide rate is evolving in my country over time, if I want to better understand if the strategies that I'm putting in place are helping or not, if I want to have an idea about how my efforts might be influencing the suicide rate, Enlace also has capabilities for that. And next one, please. So as you can see here, we have just selected a few countries just to provide you an example. You can see how suicide rate in Argentina, Brazil, Canada, and Colombia have, they are described here on the screen over time. You can see the data from the last measurement that we have, that is 2019, and you can also see the proportional change in the specific country over the last 20 years. And then you can compare among countries, among subregions, but you can also compare with the rate of the region of Americas, that it's around 9.0 per 100,000. Next one, please. And if I also want to better understand subregional data, and the question is, what is the burden of suicide by the region? Next one, please. Enlace can also describe the suicide rate per sub-region. And in fact, I can even go deeper in a specific sub-region and see what is the distribution among countries in that specific sub-region. So there is a lot that Enlace can do, and it for sure, I believe it can help a lot public health professionals at the country level, at the sub-regional level, also to better design suicide prevention strategies. Next one, please. And what is most important is that we are also here at PAHO ready to support with supporting countries and developing technical cooperation on scaling up suicide prevention strategies. We have a specific web page on suicide prevention, and in that web page you will see our updated reports. We have recently released the suicide mortality in the Americas with data up to 2019. We have a few courses like preventing self-harm and suicide, empowering primary healthcare providers, but also engaging communities in preventing suicide. And there is also the important new guideline from WHO called Live Life, and in Spanish, Vivir la Vida, which really describes what strategies can be effective for suicide prevention at the country level. Next one, please. Last but not least, here you have the access to our suicide prevention webpage. We are also here in PAHO strengthening the collaboration that we have with countries. We are conducting situation analysis in some of the countries, and we are also with specific projects targeting support to countries on suicide prevention, especially in the area of situation analysis, surveillance, and capacity building. Thank you very much.
Thank you very much, Dr. Renato Oliveira, who is the Unit Chief of Mental Health and Substance Use here at PAHO, for presenting on the use of Enlace to monitor the level and trends of suicide in the Americas, and also highlighting the link that this data has to improve programs in suicide prevention and all the resources that are available from Dr. Oliveira's unit, as well as the publication. So thank you for that. We're going to switch gears now and go look at NCDs. Now, the data portal has a lot of information on NCDs, and we unfortunately don't have a lot of time to present all of it. But I would like to invite Dr. Roberta Caixeta, who's the advisor on NCD surveillance, to talk a little bit about how Enlace can be used to monitor the NCD progress indicators. So, Dr. Caixeta, over to you.
So as my colleagues enter the slides on the screen, I just want to mention how glad I am today with the launch of the Enlace data portal. It is, as you know, one of the key elements of surveillance is to is to use the data to guide decision-making process. And this is a tool that we hope will be important and will be relevant for your day-by-day work. So what we thought to present today, showing the case for NCD, and it's a key element that was mentioned before, is that Enlace not only, and it's unique of our data portal, is not only present data on the burden of disease, also present data on the status of policies. So today I'm sharing with you one of the set of indicators that we have on NCDs that tracks policies. And it's well known as the progress indicators on NCDs. Next slide, please. So where this slide fits on this global regional movements, in 2014, the heads of the states at the second UN high-level meeting on NCDs requested the development of a set of indicators that would track and would help to monitor progress on the implementation of policies. And then we have developed these indicators, and we use it to not only track and report to UN, but also to the global and regional action plans on NCDs. And more recently, it's used to monitor progress in our PAHO strategic plan. Next, please. These slides show you what is the structure of the framework we have on NCDs. The base, we have all the technical packages that were developed based on the commitments and mandates countries have. And these technical packages can be monitored by the progress indicators that I'm presenting here today. So it's a set of indicators that show us how we are in terms of advancing the agenda on NCDs in a more comprehensive way. So the logic behind is if we have implemented these policies and interventions, we will be able to have and to see a decline or a health in the rise in many of the risk factors and the improvement on the healthcare. So we have them to track this risk factors, a set of indicators that measure the performance, and it's well known globally as GMF, Global Monitoring Framework, that will track, for instance, the prevalence of tobacco consumption, alcohol, insufficient physical activity, diabetes, hypertension, and others. And the logic also behind is if we implement the policy, if we decline or halt the rise of these risk factors and improve the healthcare, we will be improving or saving lives. We will be reducing the premature mortality due to NCDs. And this is the top of this parameter, and it's one indicator, when we call it the impact indicators, that is used to track many plans, but especially it's the indicator that is tracked in SDG that Dr. Hennes mentioned in the beginning. So this is the structure of this progress indicators. We have a group of indicators that will measure surveillance, a group of indicators that is tracking key risk factors. So we have indicators on tobacco exposure and use. We have indicators on alcohol and health, diet, and physical activity as well. There's a group of indicators that aims to track if a country has a multi-sectorial and operational plans on NCDs. Also indicators related with management, as you can see here. Next, please. So Silvana already showed the structure of the portal. So the progress indicators in the policy section, if you click there, it's the first icon. Next slide, please. You will see 3 dashboards. So first you see interactive scorecard, and we use this a lot. The ones that are working on NCDs kind of know this scorecard a bit. So we show the status of policy implementation by the 3 achievement criteria, fully achieved, partially achieved, and not achieved. And then you see by country, what is the status? You can identify the gaps, you can identify the areas that require more efforts. And we are making a call to all of you to accelerate the process to implement all these policies. Next, please. In these interactive dashboards, you also can see when you click on the specific indicator per country, you will see what is the achievement criteria, what is the mean of this achievement criteria, fully, partially, not achieved. In this case, we're showing Antigua and Barbuda, and you see what is the achievement criteria for indicator number 1. You also can present this data by subregions. You can visualize it by subregions. And there are 2 other features that I like a lot. One is you have a link to look into the report that was published. And here I'm showing the data from the last progress indicator we published. And another feature, which is the possibility of accessing the data per se. You can also download a PDF, you can download the visualization to use in any presentation. So I receive a lot of requests from countries to access this data, and we want to make available to all agencies and the community that are interested in understanding better the status of these policies. 2 important things that I want to mention to you. We have added 3 rounds of this progress indicators in the data portal, the 2015, 2017, and 2020. And throughout the year, some of these criteria change. So you'll be able to see when the criteria were changed on this compatibility node. Next, please. Then you can see a second dashboard that shows the regional perspective. So again, you can also present it by subregions, but and you will see where we are per indicators in terms of implementation. But you also, and I'm showing here indicator number 4, if you click there, you will be able to see the list of the countries that are in this category. So this helps you to see who is in this case in the high and the achieved criteria. Next, please. And the last dashboard shows the information of indicators in a map. So you have the possibility of seeing this through in a more, let's say, visual way in a map, and also having it displayed as fully achieved, partially achieved, and not achieved by indicators. Next, please. And I would not leave without making a call for the importance of strengthening NCD surveillance, and more than this, to integrate NCD surveillance into the national surveillance system. We have mentioned, I think all of us have mentioned now, the importance of using this information to guide policies and interventions, and especially on NCDs, we are making the call and requesting countries to accelerate the implementation of the policies that are translated in the best buys in our technical packages. It's extremely important also that we track progress, because if we are measuring, we know where are our gaps, and we are more aware of the areas that we need to put more effort. And finally, trying to make an analogy with the importance of vaccines on NCDs. Our vaccine are the policies that we implement. So it's extremely important that we push the agenda forward. And we just finalized the process of collecting data for our last round of progress indicators. And I want to recognize and say thanks to every focal point on NCD in countries that helped us. We ended receiving the information for all of the countries in the region, and then soon, mid-March, we will make this available in our Enlace data portal. Next, please. Just to recognize the members of the surveillance team and the department that are working on collecting data, producing data, analyzing data, and especially recognize the work that Ramon Martinez are doing and has been instrumental to put the visualization together and following the guidance from many of our colleagues in the department. Thank you very much, and I'm looking forward to receive the questions in the chat.
Excellent. Thank you very much. That was Dr. Roberta Caixeta, who leads PAHO's NCD surveillance work and the team, and has made incredible contributions to the Enlace data portal and has shown you just a snapshot of the NCD data that is available on the portal. So thank you again. And now you're probably getting a good taste of the breadth of information available in Enlace. And we have even more to show you. We're going to turn now to violence data. And I'd like to invite Ms. Britta Baer, who's the advisor at PAHO on violence and injury prevention. And she's going to talk about some of the data available on homicide and other forms of interpersonal violence and country responses, the data that's available in the Enlace data portal. So over to you, Britta.
Great. Thank you so much, Savannah. And good morning, good afternoon to everybody. I'm going to share my screen. Give me a second. Okay, so I have the task to talk to you a bit about the external causes. And I think the first thing I want to stress is how, while they're called external causes of death and injury, they're really not external to the work on public health, and definitely not in this region. Increasingly, or every single time we see interpersonal violence, but also road injury and other external causes to show up in sort of the top 10 of, in this case, cause of death and disability or other sort of lists. So we know how important it is and how fantastic it is that this tool allows us to also look at various external causes. And aside from interpersonal violence that I will focus on in my presentation, I'd like to encourage you also to click your way through the other external causes that are available in the database or in the data portal, because it's so important to understand first and foremost and give visibility to these causes and how we can take action together. Of course, homicide is one of those big challenges. The region of the Americas has the highest homicide rate in the world. Aside from that very high regional average, there's a whole list of countries that even fall above this, where data shows an even higher burden on population health. And on the health and well-being, and this is why specific indicators have been included in the SDGs, for example, around homicide and various other mandates, and where we can use the data in this portal to really look at, okay, so if I am sitting in Trinidad and Tobago, where does my country fall compared to other countries in the region? We know that, for example, the countries of the Northern Triangle have generally a fairly high homicide rate. There are selected countries in South America, like Colombia, Brazil, and others that have a high rate. But we also see that in certain sub-regions, rates continue to be high, including various Caribbean countries, the Caribbean sub-region. And the portal allows you to do this analysis across countries and across sub-regions to get a feel for where the burden is high and where action is needed. it also allows you then to click on various countries and look at trends. And this is just an example. Colombia often shows up in the sort of top 10 countries of the region in terms of homicide rates, but it's also quite interesting to then look at time trends, where we see big differences over the last 20 or so years. And again, this can be really useful data to analyze both lessons learned of how we can prevent, how we can take action and help us prioritize for the future. Of course, homicide is just the tip of the iceberg. It is an extremely big challenge in the region, but it's only one of several. And PAHO's work, and I know the work of many countries in the region, really looks at violence in all its forms, interpersonal violence in all its forms, where we also look at non-fatal violence, violent behaviors, controlling behaviors, and many different other forms of violence. And this is just to give one example. Femicide is another big challenge in the region, but it's really the tip of the iceberg. We also want to look at prevalence of violence against women, in this case, intimate partner violence, from using data from population-based studies that allows us to get a feel for where can we intervene before death, before violence escalates. And I think this is why it's so important that the portal combines mortality data with other types of data. And I'll mention this again later. Of course, aside from the added value of this broad approach to violence in all its forms, violence is one of those challenges that intersects with many different other social factors, which is why I think it's so important that we have data that allows us to disaggregate by various social factors. I think there's a lot to be done still to build up data and make it visible, to look at violence from different perspectives. This data portal allows, at least to start with, disaggregation by sex and age, which is an important, or two important considerations when we look at violence. This, for example, slide shows you data from the new child homicide estimates that were developed, because we know that while homicide spikes sort of in youth, 15 to 25, really involvement with violence starts much earlier. So from a public health perspective, we need this data to be able to intervene as early as possible in early age groups where we have the biggest chance to make a difference to children, their families and communities. Of course, this is not a new topic for the region. We know violence can be prevented. There is a whole range of different mandates. Aside from the SDGs, which have specific indicators, we have specific indicators in the PAHO strategic plan, as well as regional and global plans on violence specifically that link to indicators in the data portal. And we also have a lot of evidence, a lot of best buys of how we can address this issue. And this is just to give you some examples. And I think that's something to stress as well. When it comes to interpersonal violence, there is, of course, a need to visualize the burden on population health. And the challenge is clearly very big in this region and in select countries as well. But more than that, there's also a lot of progress that we see. And the nice thing about the data portal is that it allows us to also use data. This is an example of a snapshot of the implementation of Inspire. Inspire is one of the packages of best buys that we have on violence prevention to specifically address violence against children and youth. And it uses country reported data reported by countries on the status of their efforts in addressing, preventing, and responding to violence against children. And it allows us, for example, not only to have a snapshot of the overall progress that we see in the region in specific countries by using, red, orange, green, but it also allows us, because it's interactive data, to click on it and find out more information about where countries that are at in responding to this challenge, from which country they can learn more, what experience do they have to share with the region and the world. And I think that can be really useful data to inform next steps in not only visualizing the challenge, but also visualizing the experiences and the achievements and the lessons learned of this region. So I will conclude here this is the link to specific violence page. As I said, it not only includes data, mortality data, it includes homicide data, it includes prevalence data from violence against women. And I think there's a lot of potential to link to other different types of data that we use, fatal, non-fatal, response data. It allows us to link between the burden that we see or the impact that violence has on population health to responses and lessons learned from countries in the region. I think there's a lot that we can still do to expand around linking different social factors to the issue of violence, given that there is no single cause, but it requires us to analyze data from the perspective that's aggregated by age, sex, and other social factors, ideally, as well as allowing analysis not only by country, but also by sub-region or region, and across different factors. So I think there's a lot of potential that we can use this data portal to continue building it, to really inform the work on violence, which is such a big issue in the region. Thank you.
Thank you very much. That was Britta Baer, the advisor at PAHO on violence and injury prevention, showcasing the amazing resource that's available in Enlace on homicide and other forms of interpersonal violence, as well as the technical cooperation that is available through PAHO to help with the country responses. So thank you very much, Britta, for spotlighting that. And for the last presentation of this showcase of Enlace, we're going to highlight some of the data that's available on implementation of policies, and we're going to look specifically at salt reduction policies. And for this, I'd like to invite Dr. Leo Nederveen, who's the PAHO advisor on food, nutrition, and physical activity, to showcase how Enlace can provide information on salt reduction policies in the region. Leo, over to you.
Okay, thank you very much, Silvana, and good morning, good afternoon to everyone. This is a real important data portal, Enlace, which we are presenting today. So I'm going to speak a little bit about the salt sodium reduction policies in the Americas and how they are presented in the Enlace data portal. So we have done a mapping of the policy implementation of the SHAKE package, which is the package developed by WHO, which is based on the acronym SHAKE. The S is for surveillance, the H is related to harness the industry for a reformulation of foods and meals to contain less salt, and the A for adoption of standards for labeling, front of pack labeling, and marketing restrictions. Then we have the K for knowledge related policies, which is basically the social marketing to educate and communicate individuals to eat less salt. And then we have the E, which are the environmental policies. So all these policies are part of the best buys or the very cost-effective interventions of WHO for sodium reduction. So when we implement those components simultaneously, we will reduce the amount of salt at the population level, which will lead to lower blood pressure, a decrease of the risk of cardiovascular disease, stroke, and coronary heart disease, and it will also reduce mortality. And this has a significant positive impact on the productivity of the workforce, and it will improve our healthcare systems, less burden for the healthcare systems, and it will also lead to economic growth. So this mapping has been published in both in English and in Spanish, and it was based on a review of current policies through surveys, to a review of databases, and as well a review of web pages of existing laws, and it has been validated as well with the countries. So here are some of the data which are in the document, which from what you can see is a little bit difficult to read. So we are very happy with this Enlace data portal, which allows us to have a much better visual presentation of the different strategies. But overall, the mapping has shown that these 4 best buys, which are the elements of the shake package as well. We have had important progress between 2014 and 2019. And the data portal is a living instrument which will allow us to continue monitoring the implementation of these policies. So when we look at best buys, we can see on this map the number of best buys implemented by the different countries. And when we click on any country, we can also see which best buys are actually being implemented by those countries. Here we have another tab of the data portal. So here we can see the number of countries that are implementing policies. So we looked at different levels of action. For example, the governance policies. So 32 countries have mention of salt and sodium reduction intake in development policies, and 32 have not. Then we have, for example, 6 countries that have a specific policy on reduction of salt sodium intake, but most countries have it integrated into other policies. Then we have the legislation and regulations which are relevant for salt reduction. Then we have the best buys, which are the shake components, and of course the monitoring and surveillance as well. If there are materials as well on public awareness, and if there are guidelines. We have a scorecard as well. So for each country, we can check if there is no policy, if it's in progress, if it's a policy implemented at sub-regional level or at national level. And we also have, like by each country fact sheet. This is Argentina. We have also a repository of other policies, and when we click on the document title, we can have access to the documents. And we can also see for the different policies if they are being implemented at a national level or if there is no policy present. I would like to mention that just recently in October, we have launched a new sodium reduction targets, which is one of the best buys to reformulate foods. So these sodium targets are an update of the 2015 targets. And for 16 food categories, we have defined the minimum level for 2020 and for 2025, for 22 and 2025, that those food items may contain of sodium. This is also published both in English and in Spanish, and we have the technical document, and we have also a more political document with an advocacy focus, where we have questions and answers as well. So PAHO is very willing to support the countries of our region in implementing those targets. And definitely this data portal is a very important instrument to monitor policies, as I mentioned, a living document, and this will improve our intervention and our technical assistance. Thank you very much.
Wonderful. Thank you very much. That was Dr. Leo Nederveen, PAHO's advisor on food, nutrition, and physical activity, showcasing how Enlace, the data portal, has critical information on salt reduction policies and the progress towards those indicators for salt reduction. Salt, of course, is a key risk factor for hypertension and cardiovascular diseases. So salt reduction is an important NCD program. So thank you, Leo. And thank you to everybody who has showcased a little piece of what is available in the Enlace data portal. And I invite everybody to visit and play around with the data and see the benefit that it can bring to you in your work. So I mentioned before that Enlace Data Portal is part of a broader PAHO health information platform and data management processes. So I'm really pleased to have join us today in this launch webinar, the director of PAHO's Department on Evidence and Intelligence for Action in Health, the department that does manage the overall PAHO health information platform. So I'd like to invite Dr. Sebastian Garcia Saiso to talk a little bit about how Enlace contributes to the PAHO Health Information Platform and connected to the broader work at PAHO on data management. Over to you, Dr. Sebastian Garcia Saiso.
Thank you, Silvana, and thank you to all the colleagues for the opportunity to be here with you today and share a few comments on the importance of having the data portal and what this means in PAHO's data policy all around. I'm going to switch to Spanish. I think it's important that we give the language equity. Espero no les importe a los...
I hope you don't mind. I hope the interpreters don't mind. We have no problem. The interpreters are fine with the change of language. And I'd like to share my screen, if I may. And I want to make sure that you're seeing it. Yes, we're seeing it. Perfect. So to talk about what the data processing means and how we should move regarding the data science, which takes us to understand the breadth of the amount of data we can use and how this is exemplary for the construction of public policies. All this within a context of digital transformation of the health sector, which not only means the use of better data, but also the possibility of making a better use of the data. Now, this is the history that's been built throughout time. If we refer to what happened in the 80s, we go from the digitalization initially of the data records isolatedly in the building of relational databases, and that led then to the possibility of having database networks that allowed to an automation of local networks. And then it led to, in the 90s and after, in the 2000s, it led to thinking of the implication of sharing the information. So we have the concept of open governments and the building of clouds and how we generate better use and availability of the information. We advance to the 2010 with the control panels, or what we call the business intelligence and its initial application in health. And currently we're going into data sciences, but that has meant that we've met difficult challenges along the way. We talked, for example, of how we control the multiplicity of formats, generating the possibility of controlling records and duplications when integrating the databases, or the lack of normative and quality control instruments to actually be able to have data with sufficient quality, timeliness, and be able to share them in a transparent way. We advanced with many of these challenges thanks to the technology and the generation of technical knowledge, which allows us to focus now on ethical and legal issues of what it means to move towards these data science environments. And here, PAHO has played an important role in at least the last 40 years in building automation models and the generation of software to work in the epidemiologic surveillance networks through cooperation with the countries and the generation of technical guidelines and awareness exercises to be able to actually have the ability to use these technologies locally. And even with the development of technological infrastructures and the building of regional policies like the regional data science policy approved by all countries of the region. And this also is seen not only in a regional context, but in a global context, where the progress of technology and its adoption has been very important and has classified or characterized the speed at which we move. This is a chart showing us the rate of the population using the internet, and see how it's advanced throughout the regions, in all regions of the world, at an accelerated rate, including our own region. And what it shows is that the more people connected, the more people will be generating data and useful data and accumulating data for health information to generate also evidence on how we take steps in this field. But then we also have a lot of people that are issuing data, and this is all part of what speeds up the transformation we have in use or generation of the data. And this also has to do with the technological adoption. We see on this chart, for example, the dotted green line that took more than 100 years to reach the level of technological adoption to see, for example, the conventional lines, the telephone lines, for example.
And this compares with what we have at present. Here we have on the right the adoption of cell phones. In less than 2 decades, we have generated and have had a higher adoption of all of these modern technologies. And so we have adopted this quite fast. And then, of course, it has posed many challenges. So this talks about what was going on in the world in 2013, and then the big jump that we have taken towards 2020 in the past 17 years. The volume of data that we're generating today. And also this leads us to think that with the adoption of new technology, for instance, artificial intelligence, this quantum jump that we have given from 2017, how are we projecting this to 2025 in a more efficient data use? And also the incorporation in essential environments, especially in health. So this changes the priorities in terms of e-health. And then we are beginning to think of the incorporation of all of these policies to public health. For instance, we see the big concern that has been generated related to IT security. And also, especially with the data use, we also have a concern about the exchange of data with different actors within the system. And also, when we talk about data that has been generated by the patient, how do we place this data in safe environments? So this will also makes us think if we are to see if we are able to share all of this information. What are the main elements that we should use in sharing information in an efficient way? How do we manage patients? How do we analyze all of this data for their better use? So how many or what is the volume of data that we're generating? How big is that volume? On the right, we see the enormous generation of medical data generated. For instance, here on the right-hand side of the screen, we see that. How much we can store. So we see what we can store and what we can use. How we can better implement the use of all of this data. So if we talk about the way of introduction of all of these data management systems, we are going from the data processing part to other parts, such as processing with quality, systematization, standardization, access, integration, classification. So all of these things, new things that we had at the beginning, the traditional concepts, and we're going into new concepts. So we have to have interoperability, semantic web, open access, patient portals, cloud processing, artificial intelligence, and data sciences. It does not mean that we are replacing the traditional concepts. However, this means that we're complementing and widening those concepts, whatever is available. But data are not automatically generated. We have to have in mind the construction of all of these systems, and then the generation of all this data at the regional level. here in the region of the Americas, in 2020, we conducted a study to be able to have a route for the permanent modification of all of these information systems. And what are the dimensions of all of these data systems for health? So we have to consider the knowledge of data, governance, interaction with actors outside the system, and then what are the human resources that are necessary for all of this work, and then the introduction of important technologies, not only to widen the capability of information, but also its adaptation to the health system. So this takes us to 4 big areas of action. Dr. Barbosa and Dr. Ansel Helmles have already mentioned this. We talk about different things. Some are internal and other are external. But we have to have policies, technical guides or guidelines and notes, tools and infrastructure. We have to have the formation of human resources. And that formation of human resources has to be permanent so that we can have success in our efforts. We can accompany this at the regional level based on our capabilities. And then, of course, I cannot emphasize enough the development of tools and infrastructure and the roadmaps for each one of the environments that form part of the public health system. So we have here a regional policy on the application of public health data science through artificial intelligence. This was discussed in the Directing Council last year. And then, of course, we have to think of internal policies. For instance, the governance committee, which would be PAHO Data's governance committee. And then all of this has to be included within the data governance framework at PAHO. It has to be linked to priority actions within our technical cooperation with the countries, within their regulatory frameworks, data governance, data disaggregation, so that we can generate specific analysis, the ethical use of the data, also the ethical use of artificial intelligence and other emerging technologies. The analysis of great volumes of data, and also a new health analysis. So with this, we generate the possibility of having a new tool available, like the IS4H toolkit. All of these contain elements for generation of data to have general and national reference frameworks. And then this will all lead to the transformation of the system. And of course, we have to mention the different documents that have been prepared for the region so that we can disseminate this knowledge to local environments. We have artificial intelligence in public health. We have evaluation tools for the compilation of critical data, introduction to semantic interoperability. We have portals for patients and so forth. So the portal Enlace that we present today is a very important advance. And this is added to a series of portals available at PAHO to provide information, analysis, and a very important linkage to public policies. We have core indicators that is a very important portal. This has updated information on all our indicators. It covers a tremendous amount of data in health linked to a historical data set of 25 years in terms of health. And also we have a portal on sustainable development based on SDG 3, talking about the principles of equity. And I think that it is necessary to link all of this data in this portal, but this portal links the SDGs and also the regional objectives in matters of equity. Also, the portal of health in the Americas, it has an analysis of potentially avoidable premature mortality. And then, of course, here we discuss the quality of the indicators and the possibility of sharing data. So with this, I will finish. I think it is important to recognize the usefulness of this portal that leads to better data, better information, and wider knowledge. And the more data we have, the better our responses in health will be. We have to have access to data, information, and correct evidence at the right time and in the correct format. That is one of the critical factors for the success of the response to the pandemic and to any event in public health. In situations of uncertainty, we should have models to forecast the situation, and this is a critical factor, and everybody will be generating that data. And all teams, work teams, institutions, and organizations will be generating data, but not all of the data generated are always available or are always well understood. There are many data that are exchanged right now, so it is important for us to advance in the understanding of this data to be able to improve our answer to the health systems in the region. And a very critical factor for success is data processing in health. How do we generate this data? What is the condition of the different systems of information? And then also their publication and use. How are they used to be able to formulate public policies? If we really understand each one of the elements of this cycle, we will be able to have a wider capacity, better capacity to build better health systems. My sincere thanks to all the team in the department for this portal, for their work. Ramon, Silvana, Roberta, all the team, the director, Dr. Ansel Hennis, and also you have the support of the Department of Evidence and Intelligence to accompany your work and to solve many of the needs that you may have. Thank you very much.
Muchas gracias, Dr. Sebastián García Saizo.
Thank you, Dr. Sebastián García, for your presentation.
And for showcasing how this Enlace data portal fits into the repertoire of data portals available at PAHO, and also this call to action to strengthen information systems and the technical cooperation that is available through you and your team on information systems for health. So thank you again for your collaboration and participation in this. And we've run out of time. I know that there's been a lot of chat and contribution to the questions and answers, and we're really excited about the almost 500 participants that connected today. We encourage you all to please use the Enlace data portal, play around with it, send us your suggestions for improving data. And unfortunately, we don't have time to answer all of the questions and answers, but we will be available if you want to send us a quick message through the PAHO general email. And so now we're going to conclude this launch of Enlace, and I would like to invite Dr. Ansel Hennis for some concluding remarks. Over to you, Dr. Hennis.
Thank you so much, Silvana, and thank you so much to all the presenters. This really was tremendous food for thought. Even though I work in department, I still learned a lot about all the goings on and all the data and all the possibilities. So I'm as excited as you are in terms of what lies ahead of us. So thanks to everyone. Thanks to the participants. There's been a lot of engagement in the chat, and it's a pity we haven't got a chance to discuss it some more. But this Enlace data portal links data to action, as you've heard. Links data actions to reduce the impact of non-communicable disease and their risk factors, mental health and external causes, which include violence, neurotraffic injuries, among others. And this is particularly relevant at the time of the COVID pandemic, where there's so many dynamic changes in situations. And so I think really you've learned about the potential, we can visualize information. And it is my vision and my hope that the Enlace data portal becomes an important resource for ministries of health and public health planners and for other national institutions, the public health community, researchers, and every one of you and all persons involved in efforts to reduce the impact of NCDs, non-communicable disease risk factors, mental ill health, violence and injuries throughout the region of the Americas and well beyond. So I think the most important thing of all is the use of the data, as you heard, and Sebastian Saiso said it himself. Let us use the data, the information, and the tools featured in Enlace in our efforts to improve the health of the population of the Americas as we all work together to build a better region. I want to congratulate and also recognize a team of professionals from the Department of Non-Communicable Disease and Mental Health who developed the Enlace data portal. I won't name you individually, it will take too much time, but really to highlight the leadership of persons such as Silvana, Ramon Martinez, Roberta Caixete, and all the other technical experts who played a role. I wish to thank Sebastian Saiso Garcia for the role of his department in helping us to ensure standards were met, and also Dr. Barbosa. So really, over to you now to use the information, feed back to us. Let's make it work. Let's make it be a resource that benefits the entire region. Thank you so much for your participation and have an absolutely wonderful day. Thank you and goodbye.
Thank you. Bye-bye.
Gracias.